Hello and welcome to the Society with Fatma Shaheen at PTB World. They say that there is hope even when you are told that there isn't. And this is that one sentiment which then describes today's topic of discussion. Today on our show, we'll be talking about Pakistan's ever-evolving mental health landscape. And in this regard, it's very pertinent to mention that at least 4% of the total disease burden in Pakistan is that which is then attributed to mental health disorders. Now, despite the fact that, of course, over a period of time, we have seen there to be a very prevalent and, of course, a very staggering increase of mental health issues in the Pakistani society, there are still a lot of people out there who perhaps might not be very comfortable in talking about the same. This is also something upon which we'll be shedding light today. We'll not only be talking about the various causes of such mental health disorders per se, but we'll also be talking about typical societal perceptions and stereotypes which do surround the same. In this regard, we'll also be shedding light upon the work of the Pakistani government so as to tackle Pakistan's mental health crisis, the responsibility which then lies on media and of course on us as a responsible society to do away with the same too. All of this today, that too with an extremely pertinent panel. Let me introduce you to my today's panel. My first panelist for today's show is Dr. Alia Aftab, who is a psychologist. Assalamu alaikum ji and welcome to the show.
Thank you.
Alongside her, I have Ahmed Jamal Wattu, who is a youth activist. Assalamu alaikum ji and welcome to the show.
Thank you for having me.
You're most welcome. My third panelist for today's show is Dr. Sana Naz, who is a social analyst. Assalamu alaikum ji and welcome to the show.
I'm honored to be here and thank you.
Thank you for joining us. And via telephone line, we'll be joined by Dr. Taha Sabri, who is a public health, mental health expert. Assalamu alaikum, sir, and welcome to the show. Now, before we start the discussion on today's topic, let's have a look at this brief report.
Pakistan is home to nearly 242 million people and has unfortunately one of the worst mental health indices with fewer than 500 psychiatrists per million people. More than 90% of those with common health issues go untreated due to the country's dearth of mental health experts and services. Mental health is mostly neglected in Pakistan, where 16% of the population, more than 14 million people, suffer from mild to moderate psychological or psychiatric illness. In Pakistan, there are only a few mental hospitals and 14 mental health treatment facilities. There are 18 NGOs involved in individual assistant activities such as counseling, housing, or support groups. Mental health of children is not taken seriously by many parents. According to the World Health Organization, mental disorders in Pakistan account for more than 4% of the total disease burden, and is estimated that 24 million people are in need of psychological or psychiatric assistance. Almost 18,000 people in Pakistan commit suicide annually, while the number of suicide attempts is almost 4 times greater. Experts believe the time has come for a unified effort to prioritize and expand mental health awareness and services, destigmatize seeking help, and incorporate mental health care as a core service in primary care with comprehensive support.
Welcome back from the report. Now, to get the conversation started with you, Dr. Alia, when we do talk about Pakistan's mental health problem, one thing that we all understand is the fact that over a period of time, we have seen a very notable, rather very staggering increase in Pakistan's mental health issues. But do you feel that as a society, we still do take such issues as seriously as we do in case of physical ailments? Because a lot of times we see that whenever people come forward to mental health care professionals like yourself, even their family members, they might perhaps not take them that seriously, saying that, just snap out of it. Why do you even need to go and see a psychologist or a psychiatrist?
I do agree with you, because what happens, we don't take mental health issues seriously. Whenever there is because mental health issues come as a behavioral issue. You have temperamental changes, emotional changes, bodily changes, mood changes, loads of things together.
True.
So what happens, people say, oh my God, this is a phase that a person is passing through. It will just die down. Sometimes people think this person is acting immature. Sometimes think there is something odd or even about, but it will go away. It will pass down. And when people come to me and I tell them, no, I think it's high time. You should get diagnosis and get some treatment. So no, we don't need treatment.
We've also seen cases, if mental health issues, they are not diagnosed timely, they can even lead to physical ailments.
Mental health and physical health is related. You cannot separate them with each other. Mind sends signals to the body responds it and sends it back. So it's together. So it's going to act together, and what's going to happen then, before it turns into something very serious, that you need to go on medication. and that also serious medication for lifelong.
Right.
And it turns into disorder which has hallucinations or delusions and like mood issues or like bipolar or schizophrenic.
Of
So,
course.
then it becomes very problematic.
So at the end of the day, it's something which needs to be taken
Yes.
seriously, that too at the very outset. I'll come to you, Emma, then we must talk about the issue of mental health, that too from the viewpoint of social justice. Now, we do understand the fact that mental health per se has a very deep intersection with the society at large. The way you feel about yourself, the kind of mental health you have, that of course has a very important impact on the broader social structure of the society. So as a young person, in fact the youngest on the panel today, where do you see that link?
Absolutely, like you said rightly, Fatma, there is a big link because wherever you see discrimination, wherever you see different treatment with certain communities or groups, you see that mental health is exacerbated, it worsens for those groups.
But when we do talk about the marginalized communities, we must talk about the trans community, because they are stigmatized in ways more than one, and this definitely has a very lasting impact on their mental health issues. And this is something that we have also seen in other parts of the world. For example, in the US, which is a very multicultural society, we've also come across the fact that people who are marginalized, they tend to suffer from greater health problems too.
I think the solution to this, it's not going to be any quick solution. There is no quick fix to these social justice campaigns. It's a gradual process. You have to increase empathy for these groups. You have to listen to their voices. You have to empower them at the school, college, university level. And only then can you see them as people. And there are so many other groups that need to be given that voice, need to be given that importance. And if we don't do that, obviously we're not going to be considering their mental health issues, what they are feeling on a day-to-day basis.
True, that's very right. And our policies, they should be equally reflective of the same too. You see, everything has to have a structure in it. You can only strive for change if there is structure to it, on which I'll come to you, Sana, and here we must talk about this from the viewpoint of societal pressures. So as a doctor in your own right, how do you feel can various socio-cultural factors actually impact one's mental health, either for the better or for the worse?
There are many kind of societal pressures that women face. For example, domestic violence. For the sake of saving her marriage, she has to live with a relationship that she is struggling with. So this is something that we should talk about, and we should educate women that they have to break the silence for the violence.
That's so true. And in this regard, men, they need to be sensitized too, because a lot of times we see that men, they also suffer from stigmas in ways more than one, but they kind of internalize it. They don't talk about.
Actually, Fatma, it takes a lot of courage to speak about this mental health you're suffering from. So basically, there's a lot of stigma in our society regarding, mental health issues. So nobody have the enough courage to speak about it. So we should, there should be a lot of mental awareness campaigns. So people should feel comfortable, and it should be taken as a new normal thing.
Of
it
course.
should be taken as a very new normal thing, that it's very normal to speak if you're suffering from any mental health issue.
And here you see the society at large, they also need to change their attitude. You wanted to add something to that,
I'd
Emma?
like to add
Yes,
to that,
please do.
She rightly pointed out that as a man, it is so hard to speak up because, especially in Pakistani society, you are told to man up, be strong.
Yes.
Don't
True.
talk about your emotions, don't reveal them. Be the sole provider of your family. Like, don't think about yourself, think about
course.
others.
It's something which then goes contrary to the masculinity which we've set for Pakistani men or men worldwide. And this is something which is very unfair on them, because of course you're human at the end of the day.
Exactly.
Anybody can have depression, anybody can have anxiousness, anybody can develop any kind of a disease. Your point is well taken. On which I'll come to you, Dr. Saab, and here we must talk about the different forms of stigma which does exist in the Pakistani society. Now we do understand that times more than one people suffer from social stigma, then there are cases in which people also internalize stigma. So for the benefit of the audience, could you tell us that when we do talk about the different kinds of stigma that people do suffer from, what are those stigmas in this regard? How can we tackle the same?
Thank you for your question. So, stigma manifests in four main forms. The first form is what we call societal stigma, which we know about, which basically means attitudes of people towards those who suffer from mental illness. So for example, in Pakistani society, people who suffer from mental illness are thought to be mad, under the influence of supernatural possession. They're considered to have lack of faith, and entire families get labeled. So that's a form of societal stigma. The second form was what we call self stigma, which is internalized stigma, or when patients or people who are affected by mental health problems feel that they are not good enough, that somehow they've brought it on themselves and that they cannot get better, causing them to lose hope. The third form of stigma is what we call courtesy stigma, which is stigma by association. So, for example, if your family member has mental illness, then you are also stigmatized. For example, people don't get married in homes where mental illness is common. So, that's the third form of stigma affecting young people. And the last form is called structural stigma, which is stigma due to state policy. So, for example, until last year, suicide was a criminal act in Pakistan, but last year in December, it got decriminalized. So, the criminalization of suicide was a form of structural stigma, which prevented those affected from seeking help. So, these are the major forms of stigma.
That's very rightly put by yourself, and it's very important then to actually identify the kind of stigma that you're going through, which in turn will also, of course, dictate the kind of medical intervention you should then seek. But moving on, Dr. Saab, another question that I would want to put to you would be that when we do talk about various notable emerging developments in the field of ensuring that people do get timely medical health interventions, especially if they are suffering from mental health issues, how do you see the trends changing in Pakistan over a period of time? Because we have seen some notable developments happening in this regard. We have seen people are using telemedicine now so as to reach out to mental health care professionals, and artificial intelligence, that is also something which has become popular over a period of time.
So, one of the greatest opportunities of providing accessible mental health services is through using telehealth based systems. So, as we know, there's already a dearth of mental health professionals in Pakistan, and those who are there are focused on major urban centers, which means that those people in peripheral areas or rural areas or remote areas cannot access the sort of services they need. So, to bridge this gap, telephonic mental health services offer great promise. So, where anyone can, from the comfort of their homes, anywhere in the country, they can just pick up a phone and get in touch with a mental health professional, be they a psychologist or a psychiatrist. Our organization also has a free of cost telephonic mental health service, which anyone can reach out to via call or WhatsApp message, and we've seen it to be highly utilized, especially by youth belonging to remote areas. So yeah, so with the growing interest in digital platforms, telehealth initiatives can be very useful to address the burden of mental health problems in Pakistan.
That's very rightly put by yourself. But Dr. Saiba, I would want you to comment on this further. So when we do talk about resorting to telemedicine and of using apps in this regard too, this is something that we did see happening in the COVID-19 pandemic. But when it comes to the rural and the remote areas, that level of awareness, that level of sensitization amongst the rural population that exists so as to make this possible, because a lot of times you might come across people who might not be educated enough to even understand the fact that yes, mental health is an issue that they do need to prioritize.
I think, Fatma, the thing is that they don't even know what is the definition of mental health. What are the symptoms of mental health? What are the repercussions if they don't address to mental health? Because they have not quite awareness of it. Leave aside, I mean, as you compare to the urban areas, the rural areas don't know anything because there's lack of education, lack of awareness there. So we need to make them aware through all these social media apps. You see, like there's YouTube, there's TikTok, there's Insta. I mean, leave aside these, there's radio, which I think everybody, it's on the mobile, even you can do that.
And then we can also resort to street theatre.
Yeah, street theatres, television, you know, the more we talk about it, like if you do street theatres, it's just a drama of daily living. And that is, they're going to understand more.
That is, Dr. Saiba, such a visual and such an engaging way of educating people and people who understand that.
See, that is visual and auditory both, and we use our senses in everyday life.
True.
So, if we see and hear and repeat it again and again, it gets stored at the back of the mind. And then when it stores at the back of the mind, then we say, okay, this is what it is.
Of course.
And then it rings a bell.
Right.
Then it rings a bell.
So these are the things that we need to work upon.
Yes.
So in all, what you mean to say is that we need to ensure greater community engagement, and by that virtue also ensure that there is greater public awareness of mental health in the rural parts of the country too. Coming towards you, Ahmed, I would want you to comment on this further. So when we do talk about increasing public awareness, that too on issues relating to one's mental health, how do you feel can the Pakistani media, more particularly social media, do just that? Because we all understand the fact that yes, media is that one medium which should be used to inform people, to educate people, but then of course it also has a dark side to
First
it.
of all, we need to identify which platforms are being most used in Pakistan, especially by the youth, because mental health problems are very prevalent among the youth. So according to my research, TikTok is very widely used in Pakistan, especially TikTok, short videos, Instagram Reels, YouTube Shorts. So all of this short form content, this is the perfect medium to spread awareness about mental health. And licensed psychiatrists and psychologists can help in this initiative. They can support the country. I think government schemes should also be introduced whereby these educational campaigns are started on these social media platforms like, as I mentioned,
Of course.
TikTok, Instagram, Facebook, YouTube,
Twitter. And this
Twitter.
is something that we have seen happening with regards to other social causes. You must be remembering that very monumental movement regarding harassment, that too, of Me Too, that hashtag which actually became very popular with regards to addressing the plight of victims who allege that they have been sexually harassed. So why not in case of mental health too? And in this regard, young people like yourself, you have an extremely pivotal role to play here as well, because young people, they've been leading climate justice movements, they've been leading women marches in Pakistan too. So why not by that yardstick mental health as well?
Definitely, and I understand my privilege as well, having gone abroad to university, first to the UK for my bachelor's, and then for my master's to the US, Columbia University, New York. And I had the pleasure of being a part of many student governments when I was there. And I saw firsthand how these campaigns can be started, how they can bring about change. Because mental health is not just an issue just with Pakistan's youth. So I feel that I am in such a privileged position that I can use my platform less about mental health and to tell
Social
people,
media per se,
Exactly.
which is perhaps, I think, the young people's biggest strength that way. Coming towards you, Dr. Sanahe, we must talk about this from the viewpoint of people resorting to using filters and of course Photoshop, which is the new thing now. But we also see that this in turn has a very negative impact on one's mental health. A lot of time people would idealize pictures or those typical body images that they do see on Instagram, not understanding the fact that, you know, this is something which is not real, this is fake. So in cases like these, how do you feel can very increased exposure to social media actually impact one's mental health?
Totally agree with you, Fatma. Being an influencer is your responsibility. Whatever you're showing to your followers, it should be real, not something which is unreal or fake. So I have seen a lot of influencers, even from the West, they portray fake images of their lifestyle. They're showing their lifestyle, you know. I think they are not even happy with their lifestyle too, but they are portraying it, and that portrayal is creating a negative impact
so
on
true.
normal people.
That's so
Because
true.
normally the girls would go to different clinics and they will show images of the celebrities from the West, East, like I want these kind of lips, I want these kind of cheeks. So it's basically something very unreal, and everybody should, you know, stay away from these things.
But here the responsibility then also shifts back to the people who are using social media. I feel that they should be cognizant of the fact that everything that they see shouldn't be believed in. In this particular case, seeing is definitely not believing. On which I'll come to you, sir, and here we must talk about the work of the Pakistani government too, which does encompass introduction of a mental health app, which not only ensures that people get timely access to mental health care professionals, but also timely help too. In this regard, overall, as a public health expert, how do you see the Pakistani government working to generally improve, the mental health landscape in the country?
So the government of Pakistan, and especially the Ministry of Health, is quite involved. We have some excellent bureaucrats working in this area, particularly Dr. Naeem Akhtar and Dr. Safi Malik, who are part of the Ministry of Health, and they are in touch with the WHO's mental health initiatives as well. So in terms of, as I mentioned, political interest, the Pakistani government is extremely focused on mental health and aligning WHO based recommendations with our national policy. In terms of resource allocation, there is also an interest, but of course, the country is going through a financial crisis, and other priority areas are also neglected. So mental health is comes a bit down the list. So the real focus right now is actually that with the limited resources we do have, how can we actually deliver, sustain, and scale mental health programs? So that's the real challenge which the government is working on, and we are supporting them on this.
Right, sir. And the society in this regard, it also needs to play a very proactive role, because you see, there's only so much that the government or the state can do in this regard. Dr. Saib, I would want you to comment on this further. So when we do talk about, tackling Pakistan's silent mental health issue, how do you feel can both the public and the private sector work together in this regard? Because then again, you see, this is something for the betterment of the society. So the society needs to be involved by that yardstick.
The first important thing is awareness and acceptance. So what happens abroad? The government supports these special children. They have special programs for them. They have special centers for them. And I think we need to make them here even, where the government should sponsor, and the children, like, they take them to a picnic, they take them to movies, they do theater with them, they do karaoke with them. So we need to engage special children, all the people in this, and talk about it and accept that, look, this is the problem. Like if there's anger issues, if there are behavioral issues, accept them, talk about it, especially if it has been 3 months and over, because if you are not going to accept them, what is going to happen? They are going to change into disorders. So the public and the private sector both need to talk about it and spread awareness.
And here I feel even mental health care professionals like yourself, you people also have a very important role to play, because you see, it's all the stakeholders at the end of the day. So when it comes to mental health care professionals, an issue which I often come across is the fact that people like yourself, of course, in the course of treating others, you also suffer from a mental burnout per se.
You see,
how do you revitalize yourself?
You see, when I go home, I do my meditation and unwind, because it's very important for me to unwind, to go out and meet people. What I do is, like, sometimes people come and they say, my son, is he mad? That he's going to come and see a psychologist. So first of all, we need to eliminate this from the dictionary. We need to accept that, like physical ailments, mental health is almost a problem. It is from the central nervous system.
It's as real as any other physical ailment, right, madam?
Because they are behavioral issues, they are temperamental issues. So please accept them, that they're deviating from the norm. And this is the time we need to recognize and take help.
Right.
If you're not going to take help, you're going to suffer.
To which I would want you to add to further, because when we do talk about tackling all these challenges, Ahmed, you would agree with me when I say that definitely mental health financing, and then of course mental health governance is something that we do need to actively work upon, and this is something that we do see happening in other parts of the world, especially those who have prioritized mental health.
It is definitely good to see that the government is taking more interest in these initiatives. As the previous speaker just mentioned, it's great to see that so much investment is now coming into this, and more people are being tapped into mental health professionals to help the public in Pakistan. We were talking about this a few minutes earlier about the COVID-19 pandemic and how different crisis helplines, mental health helplines were set up in each province to deal with these cases. And so I would like to commend the government on taking these initiatives. Again, there should be more effort in this regard, and like the previous speaker mentioned, there is a financial crunch which the government is going through. But despite this, they are talking about this, creating discourse about mental health, and setting up these helplines, setting up these departments. I can only congratulate the government and wish that they continue to keep up the same vigor when talking about mental health.
True, and this is definitely something which needs to be publicized more, because a lot of times we understand that people don't even know that such applications or such programs, they are actually in place too. On which I'll come to you, Dr. Sana, and here we must talk about the very important role of educational institutions per se too. So how do you feel can educational institutions, be it schools, be it colleges, they actually work so as to ensure that yes, the stigma around mental health, that is something which is reduced, because a lot of times we see that children, they might be subjected to harassment, even to bullying for that matter, because of which they perhaps might suffer from not one, rather various mental health disorders, but they might not be very comfortable reporting the same. So in this regard, what kind of interventions do we then need at a school level?
Yes, Fatma, I think school is a very important part of everyone's life. And I think there should be proper councils present in the school, and there should be early education for the mental health awareness and how mental well-being is important for even our children, because a lot of children experience, bullying, harassment, abuse, whatever they are going through, and they don't have to live with that trauma for years and years, and until they have that confidence and they are able to speak for themselves.
Right.
So seeking help from healthcare professional should be taken as very normally.
On which I'll come to you, Dr. Ali, and before we conclude today's show, so what is that one message that you would want to give to the people out there, especially when it comes to looking after their mental health, when it comes to prioritizing self-care? Because self-care, unfortunately, is something which we, as a society are not taught to prioritize, that too from an early age. So how do you feel, can self-care be that one thing which we can use to actually have sound mental health? Because we all understand that this is a very important core fundamental of the same.
First of all is acceptance, and then seek help, because sometimes what happens, you need medicines. There are special tests even which they can have done to find out if they are suffering from mental illness, and there are blood tests they can have to, which will find out if this chemical, there is this chemical imbalance or this chemical is more. They need to accept that, and the thing is, don't stigmatize it, but you need to accept it and say that, okay, this is also something which you need to tackle and take care of, because if they are going to have medicines, then there are going to be side effects. So we need to do some relaxation exercises. We need to let go. We need to stay positive.
And also in the course of doing that, do not destruct yourself or cause destruction to yourself by self-medicating, because a lot of times we see that people are fine, but in that fear of being stigmatized so as to be able to reach out to professionals like yourself, what they do is that they self-treat, which actually worsens their position.
They self-treat, and what happens rather than self-treating, if they are having, like, everybody is hooked on to sleeping pills nowadays, let's put it like that. And what they do is, even if the doctor prescribes them for a while, they keep on having it, and then they become addicted to them.
True.
And some people go on substance abuse even. And because the society is such, they become pressurized to it.
Right.
They give
so when
into
we
it.
do talk about addressing this issue of mental health, this of course needs to be done in a broader social context, where we are equally focused so as to be able to tackle drug abuse, substance abuse, even alcohol abuse for that
Loads
matter.
of things.
Loads of things which are
And be
combined.
strong from
Of
inside.
course. Right.
That's the main thing.
Right, madam. But my last question to you, Ahmed, when we do talk about the role of the Pakistani media, because you see the Pakistani media, it also in itself has a very important role to play in this regard. How do you feel can responsible journalism play a very important part when it comes to initiating a healthy and of course a positive discourse regarding mental health?
Absolutely. I think journalists can play a huge role by normalizing talking about mental health. So we see so many popular morning shows nowadays where the topics are not really, are a bit banal in my opinion, because they're not talking about the real issues which society faces and not highlighting things like mental health. And so I feel that if, without sharing too much information, for instance, if a suicide occurs, then not mentioning the names of the person who commits that act, and sort of not allowing copycat suicides, because that is a phenomena you see in the US, where one suicide, if televised and if every information is shared about that one act, then other people are inspired by that, and we can go into mass shootings.
But before we conclude, Sana, how do you see parents' role in ensuring children's mental well-being?
This should be taught in the family, that judging any child or judging any child is not normal. You cannot judge any child based on their body, based on their color, based on their appearance. So this should be taught in the family, and this should be the part of the upbringing.
Right. So parents in this regard, they need to be educated too. And
Yes.
here again, I think something which Ahmed earlier said.
I'd like to add to this,
Right.
definitely.
The role of Pakistani media, that is extremely important, because of course you can't expect to send the parents back to school.
Right.
To which you wanted to add something.
Yeah, on the school and university level, what Dr. Saab mentioned was quite definitely pertinent. And also at the same time, I can talk about my experience at Columbia University, where we used to receive emails on a weekly basis about self-care, about
True.
taking care of our mental health. And so in one email in every week, we used to get helplines on suicide prevention, on going through like grief and loss, how to manage those emotions. And I feel it's so important to have these resources accessible to people, and something which Pakistani universities can learn from foreign universities is exactly this, that we need to have easy access to these resources.
Right.
And
this is something that
yeah.
we see happening in other parts of the world. There have been countries where there have been proper association of journalists per se, who are actually given those courses so as to revitalize themselves, especially when they have actually reported incidents which are distressing per se too. So this is something which is happening in other countries, and this is again something from which Pakistan can also learn, because you see at the end of the day, mental health is an issue which is equally impacting all of us, be it children, be it journalists, this, be it mental health care professionals, be it doctors, anybody under the sun practically. On which I'll come to you, Dr. Tahin, before we conclude today's show. So considering of that the WHO's mental health initiatives are there in place, how do you think can Pakistani government then work so as to successfully implement such initiatives, that too at a local and of course at a national level? So what would your recommendations be in this regard, given of course the fact that Pakistan is a country with limited resources?
In recent years, particularly after the COVID pandemic, mental health has received a lot of interest nationally and particularly by governmental stakeholders. And especially the president of Pakistan last year started a presidential initiative, and then the prime minister of Pakistan last year also launched a mental health initiative, which shows that it's becoming quite popular. And one of the main things that the government is currently working on is the development of a national mental health helpline, and implementation of school well-being programs, integration of mental health and universal healthcare by training lady health workers to deliver mental health interventions to community members. And also, there's been a lot of talk of policy change and actually what change establishing mental health policies that can be useful to address the burden of mental illness in a strategic manner. So these are a few initiatives that the government is currently working on.
Right, sir, your point is noted. On which note I would like to conclude today's show. Thank you so much, Dr. Saiba.
Thank you for inviting me and having me over on such an important topic.
Thank you so much, Ahmed.
Thank you so much, Fatma, for having me on the show. It was an absolute pleasure,
Thank you
especially
for
to meet the
joining
fellow
us.
speakers, and I hope to continue to contribute via your platform.
Thank you so much. Thank you for joining us. Thank you so much, Dr. Sana, for being here with us today.
It was great being here, Fatma, and thank you for inviting me.
Thank you. And thank you so much, Dr. Saab, for joining us today. Well, to conclude today's show, we generally spoke about Pakistan's mental health issues. We also spoke about that intersection which then exists between mental health and social justice per se. If we as a society are serious in doing away with various mental health issues and of course destigmatizing the same, one thing that we do need to focus upon is of course creating greater public awareness of the same. And in this regard, definitely Pakistani media has an extremely important and pivotal role to play, where there's definitely more positive and healthy discourse about mental health issues per se. Thank you for watching The Society. Until next time, take care and Allah Hafiz.